Dr. Kirsten K. Shepard. How
Yes,
are you?
I'm great. How are you?
Very good. What's the K? Your middle name, K.
My middle name is Christina.
So Kirsten, Christina.
Yes.
Wow.
Yes,
Were you a KK when you
I
grew up?
was, but my KK was KAYK. And the reason being is I prefer Kirsten, but most individuals would mispronounce it. And there was a double K at school. And so I was like, okay, well, if everybody's going to do KK, I got to be the KAYK.
Yeah.
So, yes, had to be a little different.
Yeah. No, because I remember also when yesterday when we started filming the course and you introduced yourself, you do emphasize the K. Like some people have it, but don't usually emphasize it.
Yes.
My middle name is Pele.
Oh,
Pele, like the soccer player, if you're,
yes.
but it's from the Hebrew word Pele is, I think it translates to wonder.
Okay.
So that's the real meaning behind it. But it's nice. It fits the soccer, the soccer star Pele as well. But I never, if someone asked me what my name is, or if I was filming a course, I would not use the P
You
in
wouldn't
there.
use the
Usually
P.
don't. But
Hmm.
anytime I write my name down or fill out a form, I always insert the P in, or my social media, LinkedIn. I always, or my resume
The
always has
P
the
is
P.
there.
So
Okay.
I like it. I like it. Yeah. And we have a middle name for our son, who's coming in a few weeks. But I'll tell you the middle name after.
Okay. I can't wait to get
I'll keep
that.
I'll keep I'll
Okay.
keep it away from the fans for now. Um, so how was the experience? It's like, filming an online course. Was it the first for you? Like really like putting together like an online course, like, recording something that will be floating on the internet for a while.
Yes. So definitely my first time filming an online course. Um, a lot more challenging than I expected it to be. I have thought about creating some online course content, and it's been suggested by quite a few of my peers that already have some things that are out there. I think for me, the greatest challenge was having these lights in my face, which, I've done a few photo shoots, but to really be in that spot and to remember my audience isn't my natural audience, which I may do an online course, continuing education. Most of them are in person. And so I feed off of that energy and giving myself grace when you have to pause because you mispronounce something or your brain's running faster than you're thinking. So it's a lot more challenging, and it gave me a greater appreciation for individuals that do film and video production regularly.
There's also like there's so much out, like so much, whatever topic you pick, almost there's so much information you're trying to condense and then record it in a way that looks good, and but also it looks credible, right? Credible is the key thing, because in the this world of over maybe exposure to information all the time, and this doctor says X and this doctor says Y and this doctor says a good, this doctor says bad. It's difficult for people to navigate. Do you find that, even like, as a practitioner yourself, that's always studying new things, learning new things, is it difficult for you also to discern right versus wrong? Because I'm assuming whatever, even the topic that we've been talking about, like using, medical marijuana, medical cannabis. There's a lot of yay versus nay in this world on that topic specifically for many, many, many decades.
I agree. I think that I seem to always over process things and kind of think, okay, less is always more is one of the words that I like to live by, because you can overstimulate and lose someone's attention.
Yeah.
And one of my mentors said, always give bits and pieces versus the whole overall idea, because you want to, give individuals ideas that they want to research on their own or they want to expand on. But I'm one of those people that, I can look at information. It's kind of like a movie review to where, okay, what they say on this review site versus this review site. I really don't have as much interest in that as I do, well, let me check it out and see what I think. So to make the information interesting enough where someone wants to investigate it or check into it. I think that's one of the most challenging things. It's like, okay, where do I stop? Is that enough? How much value did I bring to it? Because I could find something interesting and you might be like, that's okay. But you might find the next topic that I spoke about, like, oh, wait, what'd she say? And you can feed off of the audience when you are giving a live presentation, but that one element is missing. And so I know, okay, all right, I'm keeping interest. So we're on track with this. And so that feedback response, I think, is one of the most challenging aspects for me.
How do you think that practitioners should navigate this world of exposure to like CBD products or different products that we discussed that can be incorporated into some manual therapy or some body work? Should people, again, if it's within the scope of practice and it's legal to do what they're doing, should there be something at the minimum that people investigate, try out a bit of products even on themselves to see what it feels like?
Absolutely. I think that any licensed healthcare practitioner owes it to their patients to at least investigate, number one, the endocannabinoid system, how it works in our body and what the science is behind it to maintain homeostasis.
So so we can dive into a little bit. We can unpackage the endocannabinoid system. So is it the system that kind of regulates? I think you mentioned that regulates the balance of homeostasis, and is it always trying to send us back to that level of homeostasis that our body wants to be at?
It is the master regulator
Is it the
of
yeah?
all your body systems. So you have this nervous system, which is the master controller, the CPU, and then you have this endocannabinoid system, which is the master regulator of both the central nervous system and the peripheral nervous system. So it keeps everything in balance. The issue is across the board, there's no medical or professional education being provided in medical schools, in chiropractic, DO schools,
Yeah.
or if they are providing any, it's like a little, maybe a day is what a lot of students are sharing with me, if they're getting any information on the system at all. So first and foremost, we know patients are utilizing CBD products, and at the very least, at least know a little bit about how they work, what they are, what's available on the market, because that way, as a practitioner, you can better help your patients, whether or not you are for or against medical or recreational cannabis. At the very least, practitioners need to understand how it works, how it plays a role in the body, and at least be educated enough to have a discussion with your patients about it when they ask.
Yeah. And also to have a discussion maybe with yourself as a practitioner, because there's a lot of things that people don't know about medical cannabis. For example, that it can completely be separated from the psychoactive elements of it. So you could be using a medical cannabis product, and integrated into your practice and have no connection to any, the stereotypical view of a drug. So if we look at it that way, like through the CBD products, and what is it? Is it the full spectrum are the ones that have the below 0.3% THC?
All hemp-based products, in order for a product to be categorized as hemp, so all hemp-based cannabis products, and depending on who it is you're talking to and with, some individuals And that's where we have so many fuzzy areas in this rim is that some individuals consider cannabis only marijuana products. Some individuals consider cannabis, marijuana, and hemp. It's all in the same ram.
Yep.
But the difference between hemp is that it has a low THC content. So for anything in the United States to be classified as hemp, it has to have 0.3% or less of THC. Now, you're not going to have that psychoactive response traditionally. Now, we have a whole nother rim where the manufacturers and cultivators have been able to mimic those psychoactive responses, which is why we're seeing a lot of states not allow Delta 8, Delta 9 hemp products because they are mimicking what traditional marijuana or high THC products can do. So there is a gray area. But when we look at medicinal properties and someone wanting to have a true therapeutic response, you may or may not need THC at all because the research is showing it can be effective depending on what you're trying to achieve with 0% THC in a product. So it's all about, what is the person? And I usually start with, what are you trying to accomplish with these products? Number one.
So what are some benefits that we know of? Well, you don't even have to cite necessarily, papers out there, but things that you've been practicing and, utilizing these things. So what have you seen with your eyes, with your patients?
So what I have seen, and we started beta testing different products more frequently when my father was ill back in 2014, 2015. He was suffering from mesothelioma, so he was my first guinea pig.
So that was like what pushed you into investigating these different products?
Absolutely. The chemo and radiation, and if anyone isn't familiar with mesothelioma, that's the asbestos cancer. And so the chemotherapy, the radiation had him nauseous, lack of appetite, and he was in a lot of chronic pain. What I noticed with him was, number one, his quality of life changed drastically during that time period that he was trying these products. So our options were, he's on morphine to help him with his pain. And my father had not been on any pharmaceuticals except for one. He had hypertension at the time of his diagnosis. He was 68 years old, and that is a rarity for a 68-year-old Black male in the United States to only be on one medication. I actually remember going to some of his doctor's appointments and him getting frustrated because they'd ask him what medication he's taking. I take this for my hypertension, and they're like, and he's like, and what? Why do they keep asking me what else? And I said, because.
Like, should I be taking something else?
Right. It's common, but it's not normal. But in this society, we have normalized individuals taking multiple medications like that's just how it is. And, but seeing the effects for him, so the first thing I noticed was decreased pain. He was eating more. He's not taking this morphine, so he's able to interact with us. I wanted my dad. He was Superman to me. But seeing him, when he was on the morphine, just sleep, he could barely interact. He definitely wasn't eating, and, his quality of life was horrible. But seeing the change with just changing that one aspect and him not needing to take the morphine, it was helping him with this pain. He started to eat, to where one of my favorite stories is when we're like, okay, what do you want to eat? Because you want to eat what do you want to eat? We want to make you what you want. He wanted a fried bologna sandwich. So Yes, we're like, really, a fried, and it had to be the fried bologna with the red band around it. If you know anything about American meats, it's horrible. But we're like, whatever.
Maybe that's the the medical cannabis, the cannabis
The
munchies
advancement, yes, it
speaking. Yeah.
might have been, but that's when I first noticed, wow, it's really, there's something here, it really works. And, I knew about compassionate use, but I was naive. And, I was thinking being in California throughout the time where, they had just legalized medical cannabis. I thought most individuals wanted to use it because, they had glaucoma, or they just really wanted to have a medical card because that was a legal way. I was so naive. I didn't really understand what compassionate use was until I needed to. And that was with my dad getting sick. Fast forward, I've seen quite a few different benefits. I started doing the research on cannabis once he told me he didn't want to feel high anymore. He's like, yeah, this is cool, but I don't want to feel high. And just a note, he was not inhaling. We were using topicals and sublinguals with him because his lungs were already destroyed because of the disease. But some of those tinctures and primarily concentrates that we had high THC content. And he said, I'm too old to feel like this. Back in my hippie days, this was cool, but I'm too old to feel like this right now. And so that's when I started finding out, oh, wow, CBD, THC, and looking at the science and the endocannabinoid system. And I felt that the educational process had failed me because I'm like, okay, why am I learning all this about the nervous system, the respiratory system, the circulatory system? You learn about, all of these body systems, but nobody was talking about the endocannabinoid system, which was discovered back in the 70s. I'm like, how is that possible?
Yeah. So does it ever make you think like what other things you haven't like studied or that they haven't taught?
Absolutely. And so that gave me, it kind of opened my eyes to people will let you know what they want you to know. And why is this plant so controversial? But more importantly, just learning the history of what happened with this plant in the United States and the domino effect of how it changed in the world globally. It's disappointing, number one, but number two, why and what were the motivators behind it when we all know plant herbal medicine, eating well, farm grown versus, farm grown and grazing. We know what's best for our bodies. Why did that dynamic shift and what was the reason? But more importantly, look at the impact across the globe that it's had just in this country. It's interesting.
And so is it now like a regular use within your practice as a chiropractor, as a body worker, when people come in, it's part of what you offer and what you do?
I still have individuals who have a stigma against it. I don't push any products on to anyone. I do incorporate them into the practice if they're open to it in private practice. Yes. My goal is to educate you and give you options. The pharmaceutical company, in my opinion, has done a great job to educate people on having them think that the reason why they're having pain is because they have a lack of whatever pharmaceutical they're pushing in their body. And Americans being less than 5% of the world's population, but consuming, last time I looked, it said 90% of the world's pharmaceuticals. There's a problem. And the problem isn't coming from plants. When you look at advertising in this country, what are we seeing? Pharmaceutical commercials. We see commercials for alcohol and fast food, but yet we're always saying Americans are drunks, fat, and we're drugged. If you just sit in a parking lot of a drugstore, how many cars do you see or how many people you see coming in and out with bags? Are we less healthy? Absolutely.
From a young age too, right?
From a young age. Yeah. But is it because of the lack of X, Y, and Z in your system, or is it because of a lack of physical activity, diet, and sleep?
Yeah. And these, it always gets me. Even, now being in Austin, I'm in a hotel. And when I'm in a hotel, I flick through channels and I see some advertisements where when I'm at my own home, I avoid advertisements at all costs, and I am watching my Netflix, HBO, etc. But immediately you see the pharmaceutical advertisements, and they do tell you in the advertisements, our eyes are probably stuck on the magical family laughing and grilling and jumping in the pool. But the words they're telling us, if you take these drugs, you might feel like you want to kill yourself. You might have nausea. You might not want to speak to your kids. You might not want to get out of bed. You might need more drugs. You might need to stop using the drugs. It might affect other drug use that you take. So they give you they read a long list of things that why you shouldn't take this drug. But obviously, I don't think people pay attention because it's so ubiquitous to every pharmaceutical advertisement where you don't even pay attention to those things. But it's always there. It's always in our faces. And from a young age, it's normalized. And I think if you're used to taking drugs, whatever sort of drugs, even if it's prescribed by your primary care physician, um, you probably will keep doing so for the rest of your life. Maybe especially if it's your primary care physician that you trust so much, that every word they say is so sacred, that your parents told you to listen to the doctor. Mm-hmm. So if the doctor says something, then you'll probably stick with it. And I kind of always tried to avoid taking medications when I was a kid. I think I don't think I liked that my parents or my mom specifically was very rigid. Like, you have to take the full antibiotics, and so I think that's what made me stop. I didn't like someone enforcing it on me with no reason to, just because I was being a boy. But then when I was in sports, and as soon as you have pain, it's like already in sports, if you're trying to competitive sports, the priority of your carers, the athletic trainers, the doctors, is not really you as a person to heal you long term. It's to heal you as quickly as possible so you can get on the field, right, on the pitch. So as soon as you feel something, or if you haven't fully recovered from something and you still feel pain, which hurts your confidence, and you don't want to make it worse by being on the field, they just give you ibuprofens. And if 400 milligrams is not enough, then they give you more. And if that's not enough, they give you something else. And if that's not enough, then they inject steroids into your joint somewhere. So it is very normalized, and it's almost seen like as the right thing to do. And I think that my last bit on this is that, which I always think about, is we don't associate side effects. Like, if one has disease X, and they take a medication for it, the truth is, and the medication is powerful, they already don't know to discern where the symptoms are coming from, right? So it's very confusing that's why we need someone to trust. And back to the point, of being like so overloaded with information on what's right, what's not right. The last a couple episodes ago, I think it's the last podcast we released, I interviewed Dr. Ken Finn, who's been a big advocate in Colorado, not against the usage of cannabis, but just about the way it's being approached, and like how easy it is to get a medical marijuana card, or how easily physicians prescribe without understanding the dosages behind it, the problems with the regulation around the products. So the regulation is one that I'll ask you about and like, how do they regulate the products, and how can we trust what we buy? Because, and that came to me not from speaking to Dr. Ken Finn, but from being in Pennsylvania 10 years ago and going to a random gas station, and there's a whole shelves of CBDs and different THC thingies, vapes, chewing gum, an assortment. So you think to yourself, like, I don't really trust the hot dog that they're preparing. So how do we know we can like buy a CBD ointment, or buy your grandma a foot cream that you see in the airport? How do you know that what's right, what's wrong?
I'm going to preface this by not everyone will eat a hot dog at a gas station, but you do have certain individuals that will eat hot dogs in gas station sushi. Okay. So if that is what you want, go ahead. But I mean, the quality of that sushi versus going into a high-end sushi restaurant, you're more than likely going to have some digestive issues from eating that gas station sushi,
Which is a good point.
which is a good point. Don't eat
Yeah.
it.
But okay, but then I'll interject your preface to the answer, and I'll make a separation for the hot dog analogy, because they are cooking the hot dogs in the gas station, but the CBD products are packaged, right? And they do have stickers on them, and different, governmental organizations that regulate the products.
Not necessarily.
So that's what we like to believe.
Yes,
When you
that's
see
what
a
we like.
logo, you see a logo.
So instead of saying the hot dog, let's go back to that gas station
Yes,
sushi.
yes.
That gas station sushi is packaged up from whatever company that made it, and it's sitting in a cooler. One of those tubs that you just grab. You don't know how long it has a date on it, but is that a proper temperature? Like, would you trust that versus some sushi that you get at even a mid-grade restaurant? So challenges, at least in the United States, is cannabis, medical cannabis and recreational cannabis. I feel like there's been a good job that's been done when it comes to regulation. Hemp-based products, which is what you're going to see most of the CBD on the market, is going to be hemp-based. There's not any regulation. So the only companies that are practicing good business practices are going to be, hemp GMP certified, and pay the extra money because you don't have to. I know at one point the FDA had done a study to where they tested quite a few products, and over 70% of the products that were on the market did not have what they said they had in them, according to the certificate of analysis. It's not inexpensive to do a certificate of analysis, but as a consumer, you should think, okay, you get what you pay for with certain things. I would want to have a reputable product from a reputable supplier, from a reputable company. I don't want to buy CBD from my local gas station. I don't want to buy it from my pharmacy, unless it's a high-end, specialty pharmacy. I'd like to know where it's coming from. And until we regulate things, but we also have to look at how much regulation is great. So in states that have medical and recreational cannabis, they're having to go through a rigorous licensing, testing, certification process in order to have these products. Now, if we look, the hemp market in this country has kind of been like the Wild West. But then again, how many products, that are FDA approved are recalled? Like, I can name a couple of 1-800 commercials that the attorneys are now going after certain pharmaceuticals that were approved by this organization. So it's more
All the time. All
all
the
the
food
time.
products too. Yeah.
Always recalls, but yet, we want this certification, but you have to look at, okay, what companies do I know?
Yeah.
And what am I familiar with where I know they're going to look out for me and, ask for those certificate of analysis. I'm sure 7-Eleven doesn't have those readily available, or any convenience store is not going to have those readily available.
Nothing against 7-Eleven.
Nothing
right?
against 7-Eleven. I love my Slurpee now. But a lot of convenience stores and a lot of, you see the little smoke shops and everyone's advertising this and that. As a consumer, do your due diligence. I would trust more from some sources than others, just to say that. You can look at, and it's not necessarily to go along with, you get what you pay for, but at times you do. What's the quality of, this convenience store bag gonna be versus the quality of a luxury end item?
Did you have you had bad experiences with products that you purchase?
I have, but the bad experiences that I had with products that I purchased weren't necessarily batch or recall. It was personal preference on quality. I've done a lot of independent research, and I'm one of those providers, no matter what the supplement may be or the product, it could be something as simple as what type of um, cream are we going to use for our therapist. And I want to try it on me because if I don't like it, they're not going to like it. It's, if I carry, a vitamin, I like liquid vitamins. I feel like they're absorbed better in the body, and that's just my personal preference. But if I don't like the taste of those vitamins, I'm not going to have my patients even try it because I'm like, I don't like the taste of it. I'm not going to sell. So I do use myself as a guinea pig a lot. There's some states that I've tried certain products in those states when I go visit, and I'm like, this tastes horrible. Like how are they letting this, be a product that's on the market? And then other states I like better. So I think it's about personal preference when it comes to certain things, but also that educational process is like, is this going to be effective for the intended use that I want to achieve?
Are there any obvious red flags besides the institution where you're buying the product from, like gas station? But are there any obvious red flags on the packaged goods that you buy? Like I can think of, like if someone's selling you marijuana flower in a Ziploc bag, that's okay. So that's we should avoid that most likely. But is there like something like that? Because nowadays the problem is that it's so easy for these like company to buy professionally looking packaging. Even the black market, like they'll sell you professionally looking, packages with fake FDA approvals on it and disclaimers and all that
Mhm.
stuff.
And it is challenging. I look at the source of where, the biggest thing is what's the source? Where did you get it from? But I think that, in the same aspect, we can go back to the pandemic when we were on lockdown. We saw a lot of that with masks. We all wanted these N95s or the KN, 95 masks, and we wanted the ones that were FDA certified and all this. So then we find out that there's this mass production of bogus products. It's, and we can go back to that same analogy with, a high end bag. If someone is selling you a high end luxury bag that should be $15,000 for $100, more than likely than not, that is not an original, right? So I think we have to look at not only the source, because there are a lot of copycats of where you're getting it, but also um, where you're purchasing these items. So not only, okay, I found this really cool thing at this store, but I know this person, I know they've tried it before. I know where the source is. I know that they more than likely have product insurance. I know as much information about this product, I may try it.
Yeah.
So I think it's more education that individuals need to do and consider versus not.
Using it with your patients and clients over the years, um using like topical creams and things like that, have you seen like a percentage of your patients allergic to any products?
I have literally had one patient have a reaction to our salve, and that's because it has lemongrass in it, and she was allergic to lemongrass. We found out the hard way. I don't even think this patient knew she was allergic to lemongrass.
So nothing to do with the cannabis.
Nothing to do with the cannabis. I've also had a couple of patients be allergic to it, the adhesive in our K tape or our pain patches. So if someone has sensitive skin naturally that they have to use, a sensitive detergent to wash their clothes, then I would not recommend, utilizing the topical patches or tape, because more than likely you're going to have some type of reaction to that. Hasn't been many over the last, almost 10 years now. Hasn't been many that we've had that experience with, luckily.
Yeah, it's so interesting. And the K tape thing was interesting. Just like, the fusion of products, really. Because K tape in itself like plays a part, like does its thing. Um, and there's a few different components in that, but then we're also infusing it with CBD that slowly drips into the body, right? With slowly consumed into the body. So, what is like for something like a patch, a topical, the K tape infused CBD? What are the benefits that one could, potentially see from using their products? And again, no, when we're talking about CBD, there's no psychoactive components to it. So what can one expect? Why? What is the selling point um, for using topical CBD products?
So with the topical CBD products, number one, it helps with pain modulation. It decreases inflammation. And depending on if you're using a tape or a roll on, depending on what product you're using, it can also provide some supportive. So the tapes, similar to any type of topical analgesic tape that we see the athletes using. It's supporting those muscles, providing some stability, helping with the healing process, and stimulating the flow of the blood in the lymph. So then when we add a plant component that has both analgesic, which is pain relieving properties, it has anti-inflammatory abilities. It also helps with regenerating the nerves and protecting the nerves because of the neuroregenerative and neuroprotective properties. You're adding in an extra oomph to it. So if you want, you can have regular, or you can have that super unleaded, is how I describe it to patients. And I think just that little bit of extra stability makes a difference when it comes to topicals or some of our roll-on. The roll-on is like a very popular roll on that you see. And I believe, one of the famous retired Hall of Fame basketball players is a endorser of one of those, or spokesperson for this one brand. And we see it all the time. It's something that has a cooling sensation. Menthol feels great regardless because it is providing a cooling sensation. And when you add that on, something that's already inflamed or a painful joint, I think the benefit to me of topicals is that you can go directly to that area and apply something that's going to give you relief. That's the benefit, whether or not it's cannabis infused and it's a topical product. Now, adding in the hemp-based CBD, which is what we use with our products, then you're adding in that extra bonus of, okay, this really helps with pain relief. This is, and the research is showing that the inflammation, it has the neuroprotective, neuroregenerative properties. So you're giving it that extra super boost to it, versus what we traditionally do when someone's in pain, which is you go to your primary. They're more than likely, and a lot of them have changed this, but I'm still seeing it when I get referrals in, muscle relaxers and pain relievers. You're giving someone something oral to take to target their shoulder. And a muscle relaxer doesn't know, oh, I'm just going to go to Danny's shoulder.
That was always a question I have. Like when I take a painkiller, how does it know?
It doesn't. It's affecting you systemically. It's not just going to that particular area. And that's never made sense to me. And then we see, fast forward, this opioid epidemic and crisis that we have now because of falsehoods that the pharmaceutical industry And certain companies within the pharmaceutical industry have misinformed, miseducated, and blatantly lied to practitioners. And we change things slightly on how things are done, but it never made sense. If you take a muscle relaxer, maybe your upper trap or your shoulders tight. If you take an oral muscle relaxer, it's not just loosening up that tight muscle, it's making all the muscles around it, which are probably weak, which is why you have this overworked muscle, weaker. That makes no sense. You take a systemic pain reliever, it's not just targeting your shoulder to where, okay, we're going to make sure the shoulder doesn't hurt. No, it's affecting your entire body. And we take this approach that, okay, if I didn't get prescribed something, something's not right. And we need to change our thinking because it's not fixing. When are we getting to the root cause? We have tools, which is why I love being in holistic care. I think we need to address the whole person, because if someone comes to me with shoulder pain, and more than likely it's not just the shoulder, we got to look at the neck, the low back, other areas. But we compartmentalize things, and we are a symptom-based society where we think just because we have a lack of pain, we no longer have a lack of dysfunction. And that's just dysfunctional thinking in itself.
So why, when as soon as you say the word holistic, there's people that listen to that word and immediately, she's probably way out there for me. She's probably crazy, on the verge of a witch type stereotype to the word holistic. So for you as a practitioner, what does that mean? And like, speaking to also to other practitioners, like, why, in your opinion, should everyone at least consider that as not something, at the minimum, not something negative or woo-woo, looking at patients, clients holistically?
Absolutely, because we've spent so much time compartmentalizing healthcare, and we know that just looking at the pain realm, right? If someone has shoulder pain, more than likely there's some neck involvement. There's probably going to be some mid-back involvement. But I'm isolated and only thinking about treating your shoulder. That makes no sense at all, because the imbalances aren't just affecting that shoulder. It's starting to affect how your neck moves, which you may have, some collateral responses, and you're recruiting accessory muscles just to get your shoulder to move because it's been hurting. And we don't look at the whole person when it comes to dysfunction, because we've been so symptom based. We can't just compartmentalize healthcare, which is what we've been doing, which is why, and when I say we, I mean in the United States, which is one of the reasons why we rank 37th when we compare our rankings, and then with the World Health Organization has ranked us as 37th. Right, out of all other countries,
General
in the
healthcare.
quality of our healthcare, right? But yet we spend the most money per capita. We spend the most money as a nation, trillions of dollars every year. Last time I looked, it was like $3.4 trillion a year being spent on healthcare. That number is going to continue to increase. That's every year, because we have a population of baby boomers that are continuing to live longer. So living longer, if those quality of life isn't healthier, guess what? It's going to be more and more expensive to have that longevity. The problem for me is, how can we spend all this money, but yet our people aren't well? There is a disconnect. And part of that disconnect is we've spent so much time trying to compartmentalize things instead of saying, okay, let's look at your diet. Let's look at your exercise level. Let's look at this instead of looking at, okay, let me just turn off the pain signal and you're going to be fixed. No, you're just creating more problems that are going to occur in the future. That's why I believe that a holistic, and if anyone who hears that word, whether you're using it whole, HWHOLE, or with the H, if that's turning anyone off, then that's somebody that's not going to come and see me anyway. That's probably someone who's sitting there and they're on 8 to 10 to 12 to 22 different pharmaceuticals because they feel like the problem is that lack of that medication in their system versus them being accountable for some of the lifestyle choices that they've made or how they've approached their health.
Sports, you mentioned that potentially that you have some interest in like working with sports teams, and are you a sports fan at all?
I am. My favorite sport, anybody who knows me, is basketball. I am in Texas. My favorite team is very close to Austin. It's the Spurs. I've always been a Spurs fan, and I'm one of those individuals that if there's a game on and you call me, I'm not going to answer
So
unless it's
you
my
watch
child.
every Spurs game?
I usually, whenever I can, I do, and usually try and go to at least one or two each season in person. I'm a huge basketball fan, and I love the WNBA, so I've been, watching more of that too later. But I would love, that was a dream of mine to actually, maybe travel with a professional sports team and work. So we'll see if that happens. I'm a little more mature now, so I don't know if I can handle the road as much as I think I would.
And prima donnas as well.
Ah,
Treating prima donnas,
yes, but I
because I
think
also feel like the relationship between an athlete, especially a guy that's a woman who's on millions of dollars, is a lot different. The dynamics between the athlete and the chiropractor versus real life, patient and doctor. Because the expectations, the attention that they think they deserve, the value also. Again, you want to probably get them back on the court as soon as possible. B, you're worried about them getting re-injured, and C, you have the people that have spent money and have interest in this in this athlete succeeding, bringing them in more money, winning games for them. A lot of pressure, I feel like, for the medical teams of these clubs. I feel like it's tremendous pressure.
I think from some of the sports and most professional sports teams, if not all of them now, have chiropractors that are a part of their treatment team.
Yeah, is that standard?
That's standard. That's pretty much standard. I don't know of any teams, and if there are any teams that do not have chiros out there, call me. We can talk. But most do, and when I speak to these athletic, these sports chiropractors, it just enhances their recovery, and the coaches, the teams, their general managers, the players even know, and that's why we see them being treated less, a lot different than an average individual. So I know at the start of the podcast, we kind of talked about the athlete with their injury and what you had experienced where they were giving them pain medication. What I've seen in recent years is typically the athletes and the celebrities are the ones that are getting the best care and how care should be. If we see an athlete who's injured, and we can use basketball, first thing they're doing is taking them off. They're putting them on a sideline. If they're not starting an immediate evaluation, which usually they do, they're also icing because they know inflammation first. Then they take them back, immediately do some imaging after they've done a small assessment because they have access to MRIs, ultrasounds, whatever they need to do to see what's going on. Because like you shared, that's a lot of money, that's off the court now. And especially if it's one of their superstars, they're trying to get them back on as quickly as possible, but they don't want to do more harm to them. If we look at the average person who may need to get an MRI, and this is one of the frustrations I have about this sick care system in the US, and yes, I call it a sick care system, because if we were focused on healthcare, we'd be focused more on wellness and education and prevention. Our sick care system, I can have Miss Millie, who injured something. She's been, the question when I want to request an MRI is, has she done any conservative care? Have they tried pharmaceutical intervention? And 90% of the time, the person who is the decision maker on whether or not they're going to approve this imaging has no medical degree. So I'm fighting with somebody trying to tell, okay, she's got numbness and tingling going down both sides of her back. Well, we're going to deny it. Where this athlete, they get it like this. So our system's fundamentally broken because you're causing more damage, but we value profits over people, and capitalism can be a great thing. It can be a blessing in certain aspects, and then it can also not be a great thing because these insurance companies and pharmaceutical companies are not in business to get you well. They're in business to make profits for their shareholders. And the more we think about the system, the more it should frustrate you as an individual if you have these concerns and if you really want to fix something and advocate for things that focus on solutions and root causes that can help you most naturally and non-toxic versus reaching for a pharmaceutical or keeping to do the same thing. What is it? Einstein doing the same thing over and over and expecting a different result. Insanity. It's just insane. We're not going to see changes, and we need to.
Even like, I've been using like just like body lotion my entire life. Only the last few years, like I started realizing how most of them, how bad they are for me. And then also I realized that they're not creating the body lotion to smooth my skin forever. They're creating like a dependency for me on those products. So like I'm subscribing to, every few weeks I'm spending money on this body lotion to give me temporary relief for my dry skin or irritated skin, just so that I can finish that bottle and on to the next one, on to the next one, on to the next one, forever and ever and ever and ever and ever and ever. So a complete dependency. So just why, and I think a lot of that creeps into the questions I had about the marijuana products, because just that trust, because we need someone to trust, because it's so difficult to, if you have kids, we spoke about all the sleep deprivation that goes around having kids and all those things, and work, and who has time to really navigate all these things. So it's like we're looking for someone to trust. But it is difficult. But for you, in your career, what was so you started out as a massage therapist. So how did you end up in what you're doing now in chiropractic medicine? And I know also we can take it even a step back. You said you were pre-med at university. So what was your story to end up where you are now?
When I think back on it, there were several layers of my story, although I didn't realize it until later. But one instance is
Steve Jobs says you can only connect the dots looking back.
That's it. That is absolutely true. You can only connect the dots looking back. When I was in maybe 6th grade, my older sister was graduating from high school. And my grandmother had come to visit from California. What I remember is, and it is looking back because I shared this story with my mom one day. I remember grandma always telling me, and I may be wrong, but I heard she was the first woman in California to maybe have a hip replacement. So I remember grandma always bragging on a new joint. But, being 12, you don't really think about it. Fast forward to my sister's graduation, grandma came to visit. She had a counter full of medication. The whole bathroom counter. And I was like, why do you need all this? Like, just looking at it at that age, knowing nothing about healthcare, I'm like, what is this? What do you need all this for? Well, this is for my this is for my that. So I saw it, but I didn't pay attention until years later. I do remember grandma it was Grandma Europa, going to a new, younger practitioner who took her off of everything, but maybe for those medications, and we're talking 20 plus, maybe for those medications, and how great her quality of life was. So looking back, I think that was my first introduction to something ain't right. Fast forward as a student, right here at UT, I was in a car accident. The car was totaled, and I went to the emergency room. They gave me muscle relaxers and pain medication, which I have a low tolerance. about to fail out of school. And if I took the medication, I cannot go to class because I'm in too much pain. If I didn't take it, if I took the medication, I am sleeping because I'm zonked out. And one of the girls who lived in the dorm asked me how I was doing one day, and I'm like, not good. So she tells me her dad can help her. Her dad turned out being a chiropractor who also had a massage therapist that worked with him. He was the first practitioner to touch me. Like they're usually like, oh, it hurts there. Here, take this. He explained to me, what was happening to my body. It's sending blood to the area to prevent further injury. We did some range of motion tests. He told me the massage therapist was going to help loosen things up, get the blood and the lymph flowing, which is going to help with my pain. And then he'd come in and he's going to do some joint mobility to get those segments that are locked up moving. I never had a doctor talk to me, educate me about how my body actually functioned. I also have quite a few members of my family that are in the medical community, and I remember them, just prescribing and also not having that job satisfaction. This guy was whistling in his practice. He was happy. Sometimes he'd be coming off the golf course. He had a lot of leisure in his time, and you could tell he had joy in what he did. My other family members seemed stressed. They were always working. They didn't have time for their family. So there were a lot of things that helped me, but more importantly, he helped me feel better. And I was like, I want his job. And while I am working to go through chiropractic school, I'll go through massage therapy school so that I can pay my way through school. I was naive. I did not know how expensive chiropractic school was going to be, but it did help me with understanding the body, how it moves, a greater respect for anatomy and the muscular component to how chiropractic works. So I think it made me a greater provider, and my journey being what it was, I practice a lot differently than the average chiropractor would, in my opinion. Several do address the muscular component, but I see it and I've experienced it. So once we have personal experiences, I think it takes you a little bit deeper with what you understand and how you want to help people.
Yeah, so if you had to define like maybe how a different way with you would approach something versus an average chiropractor, what would that look like?
First, I always have to soften up the muscles where standard chiropractic visit, and keep in mind everyone has their own art, but across the board it's usually a adjustment. So you have a lot of we have a lot of chiropractors, they simply adjust. I am not going to adjust until I address the muscular component, because if I haven't loosened up the muscles, I feel like I'm spending the majority of the time trying to get these tight muscles to loosen up so that I can adjust. Um, what I've found is that the adjustments for my patients last a lot longer because those muscles have been loosened up. And if I am adjusting only, it's probably going to take me a week or two just to get to that muscle memory. So that's the biggest dynamic. But that's also my experience in the profession was this is how I was introduced to it. You loosen up the muscles first and then you adjust. So to me, it makes sense, but not necessarily is it going to prohibit someone from having that relief. I just think it makes it better.
And it sounds to me like spending more time as well with each patient or client that comes through the door.
We spend on average anywhere from 30 minutes to an hour and somewhere in between. So it's not a quick 5-minute visit. There are places for individuals that don't have time, and that's the type of treatment they want. I think it's all beneficial. The science does prove what the physiological effects are on the body with adjusting. For me, I'm like, it's that added bonus to it. And I really enjoy the outcomes that I see with those patients.
When I wake up in the morning and I crack the left side of my lower back and again the right side of my lower back, why are you making that face? Is
I have
that
a question though. Are you cracking it like forcefully, or are you just stretching and you're getting a release from the joint? Because I see both and
that's a
they're
good
not
question.
equal.
I think I do both. I think there's areas of my body that where naturally I just have to make like a nice, movement, and I can feel like a pop that feels good. And then I definitely, when I do my lower back a couple times a day, it's probably more forceful. Should I avoid the more forceful ones?
You probably should,
Didn't we see
because
someone in the studio? Didn't CJ did it, right? So when you see someone do that, what goes through your mind?
when it's a natural movement, so if I reach back and my joint is noisy, that's okay. But if I'm reaching back and I'm forcing it to go, you have to think about the integrity of that joint, what you're doing to the ligaments. Like, I had to go through a lot of training to learn how to adjust,
Yeah.
but oftentimes you can see wear and tear in joints and segments because you have hypermobilized a segment that should not be moving as much.
Mm.
And, you can wear out certain joints and the bones. So why speed up a degenerative process if you can
Yeah.
avoid it? So I'm perfectly fine with, okay, if you stretch and you have some snack, crackle, and pop going on, some people's joints are just noisy. But if I'm forcefully, I'm going to make this
That's me.
adjust, or the thing that makes me cringe the most is the neck pop.
Yeah.
You have some really nice facet joints that like to stay there. So if you want to wear them down and
Okay, so I do crack the neck. I don't, not as forcefully as some people that I see that you're like, that it seems like they're doing too much. But I do crack my neck. I don't even use my hands. I just like
tilt, and it kind of
tilt until
releases. A tilt is okay, but I've seen that. And I'm like, okay, we're self-adjusting, like not a
So
good idea.
so and my wife sometimes calls me like a self chiropractor because I do, like, but why does it feel so good when you crack the back like forcefully?
Any kind of
on
joint release feels good, but why not do a sustained stretch?
So I'm at the point with my lower back, not that I have problems with it, but I'm so used to cracking it left and right every morning, and then like now sitting for a couple hours, I'll get up and I feel like I need it. Now I could carry on with my day without doing it. I could, but it feels like it needs it. Now I don't know if I'm like addicted to that
It sounds
sensation.
like you're addicted
But
to
is it
cracking your own joints.
so is it like when people are like, and I used to be way worse with like cracking your knuckles. Is that also, are we like, do we just get addicted to that sensation, that pop, that second of relief?
I am not sure, and I'd have to investigate the scientific evidence. I'm sure something is being done. If not, there's some researcher. But if it feels good, typically we want to do things as humans that just feel good. I think that's, one of our characteristics. If it feels good, we want to continue doing it, which is why, we have so many different characteristical traits. But I think that if perhaps you doing something to excess is not good for you, then why not, limit that, or, go to the professionals. Like, if it was that simple to where you can master things, and why would we have to get a degree to know how to properly mobilize segments?
Yeah.
I also think that when you repeatedly force certain things to move, like I can move my thumb and you might hear some,
Yeah.
but I'm not forcing it to do that. Why not just stretch? Maybe the reason why it feels good is because you might have, some type of hamstrings, or your hip flexors are tight, pulling on your pelvis. So when you wake up, those short muscles want to lengthen, and stretching may benefit you. So looking at, okay, it feels good. I'm just going to, forcefully pop it. But like I said, for me, I'm fine with, if somebody stretches and they get a gas release from the joint, that's fine.
So I'll be more mindful to my force for cracking of the back. But what I do know is that it feels good. That's A. But what I also know on the other side is that it definitely is temporary relief, because a few hours later, much needed. And the next morning, it's a must. Like, it's a must to carry on. So I'll play with it, and then we'll see. We'll see what developments I make. Also, like, and I, there's certain movements, like you said, like the professionals that know what they're doing with the joints and how to adjust them. Even with myself, it looks really complicated. Like the stuff you see. Or if also I've had, like, my back and neck cracked by a chiropractor. I would never attempt those things on anyone else, and I would never attempt them on myself. But when you get like super familiar with a certain movement in your own body, it's like easy to even overstretch and overdo. And even like, even with stretching, you can very easily overdo it just because you feel familiar within your own territory, and there's no one there to judge your movements, right? It's just you and yourself kind of playing with it. And it's difficult to see long term, like something that could feel good short term. It's difficult to see the long term consequences of cracking your back every day. But I will avoid it. And I assumed today, when I saw you in the studio and CJ cracked his back, I assumed that you would cringe from something like that. Because I also, when I see someone else, like I did today, do it to themselves, it's the only time where I can like self-reflect and see myself in them for a second, because I'm never doing it like in front of the mirror, or I'm never doing it in public, you know? Something I was going to ask you about was the Psoas, the Psoas release. The Psoas muscle is like, also, it's one that, is so ambiguous, and people approach it differently. People approach it from an anatomical standpoint. People approach it from a religious standpoint, from a mental health standpoint. So what, from your perspective and your experience, what is the Psoas, and why? And I think you mentioned even that, like, you've had people like, break down, like crying after you release their Psoas. So yeah, what is, from your perspective, what is the Psoas?
So first, I'd like to preface by saying we're saying Psoas,
Oh, yes,
Psoas. That's one of the questions. Like, what?
The
What do you want
Psoas,
me?
yeah,
What you say? And when you're a body worker, dealing with touch, there are several areas that individuals can carry stress in. So it's natural to have different types of responses. I've seen it a lot when you're doing, neck and shoulder work. You might have someone who chronically carries everything here, and there's different causes of what we call subluxation in the chiropractic world. There's trauma, there's thought or stress, and there's, physical environmental influencers like pollution, etc., that can put stress on the body, right? And if you are holding a lot of emotional gunk, it can manifest through releases in certain muscles. So I've seen quite a few individuals with working on their shoulders. They may cry and not understand why they're crying, because they've been holding on to so much in this muscle. So the muscles do have memory. With the psoas, one of
Which is
the
really difficult to like, to understand, right, and to relate to.
Sure. It is hard for people to relate to, but you can see, and it doesn't happen every time, but I've seen both men and women, have these types of physiological responses when you release a muscle. If they've been holding in and they may not be aware of, wow, I've been holding a lot of emotion in that area. It has happened. And the psoas is a muscle that is a deep hip and knee flexor It uh, it's an interesting technique, but I was taught by a doc out of Miami years ago. He's a chiropractor in Miami, and I'm sure he's probably still practicing. I can't remember his name right now, but I will let you
Yeah,
know.
yeah.
Thank you, Doc.
Yeah.
And he taught me years ago, you know, the low back, one of the muscles that people often ignore when there's low back pain is a psoas. Now we see a lot of devices. I'll have patients ask, "Oh, I have this little hook thing, and it said," and I was like, "I wouldn't try that on myself because there is a lot of."
Because they look aggressive, those
They
products.
look aggressive. There's a lot of sensitive organs and your digestive system's right there. So I don't know if I'd trust to try and do a psoas release even on myself, but some of those devices look really intimidating. But releasing that can be quite effective when you're dealing with someone with low back or lower extremity pain. So that was one of the areas that we release today on someone. But it is interesting when they have that response, and I just have the Kleenex ready, and I tell them, it's normal. I remember going through a massage therapy class and being taught that, some individuals may have an emotional connection when you're doing body work. And I've actually worked with a couple of behavior health practitioners to help patients. We co treated a few of them to help patients that had been abused, and they're not able to be touched at all because of physical abuse. To where I remember one lady, I couldn't even touch her initially, and the behavioral health specialist was in the room guiding them through what I was going to do. We had to talk about every little touch that I did, and then we progressed to where through continued therapy, this individual who wasn't able to come see me by themselves was like, "Hey, I'm here, get on the table." Like, "Okay, come on, let's go," and so being able to help guide someone and being a part of the healing process in so many different aspects has been a joy. But yeah, emotional connection, physical.
And the psoas is believed to hold like the shoulders, like the hips. The psoas too is like on
Any
its.
muscle really, really can. But I've noticed throughout my 25 years of just being a massage therapist, I've noticed certain muscles are more likely, to elicit
Yeah.
that type of response than others.
And sorry if I'm throwing you under the bus here, but you mentioned that at times when you're like performing muscle releases, you like to close your eyes. So like, what are you when you do that? Are you thinking of anything? Do you have any like visions? Are you what goes on through your mind in those moments?
Typically, when I close my eyes and I'm working on a patient, I am really tuning into what their body's doing and how I am helping to facilitate their release, relief, or what have you. Most of the individuals that come see me, they're not coming to see me for wellness. So most individuals are actively having some sort of pain, whether it's acute or chronic, um, or mobility issue. And I feel like it's just like, blind individuals have that sixth sense. It's like you exclude one of your senses, then it's going to enhance the others. So I feel like I'm more in tune. I can feel what that particular muscle is doing. I can help, especially if it's, an intense trigger point or, some scar tissue that we're working through. And I feel like, that muscle's talking to me on high volume and in high definition versus if I'm not. And then it also turns off because there's a lot of environmental stimulation that you can have. I just feel like it gives me a deeper focus, and it's been something that I've been doing for years. So I'm like, okay, what you doing? And it gives me a moment with me and that person's body.
Have you tried like any sort of like craniosacral therapy?
Oh, yes, I practice. I incorporate some of everything. Throughout the years, I've had so much continued education, so much training. I love researching things. There's so many techniques that I'd love to learn more about. I feel like as body workers, we tend to create our own art. And it's similar to, like Picasso. Picasso has his own technique and style that I'm sure had many different individuals that influenced that. And it just makes his masterpieces that much more spectacular.
Do you have that's a good that's a good way for, I think, for anyone to kind of perceive what they do, right? Because it's their way, their art, their expression, um, built on foundations that you learn, and shouldn't be looked at limited by the foundations that you've learned, right, to be qualified or whatever, what have you. um from a business perspective, like I think you mentioned also that you like consult and help maybe people maybe earlier in their journey, like setting up their own businesses and that type of thing. Do you have any tips for people, maybe certain like mistakes that people make early on with when they shoot themselves in the foot, because especially nowadays when people are exposed to so many successful massage therapists, chiropractors, body workers, with the age of social media and all the YouTube and all these things. So a lot of people have more of a something to aim for, because they can see that so many people are making it, doing it, which means more people trying, probably also more people failing at it. So do you have any like words of wisdom for someone who maybe has started and themselves and has say in air quotes failed for now, or someone who's maybe nervous to make the jump and leave their job at whatever franchise and start something themselves? What would you say?
Absolutely. Well, I mean, first of all, I have to say, with all the years that I've been practicing, I too have made those mistakes. So if I could save someone time, money, and hard lessons learned, I definitely would. I think one of my mentors, Melissa Bradley, she's with 1863 Ventures. Hey, Melissa, shout out. But one of the things that she said was start with the end in mind. And oftentimes, we don't have a clear vision of what we want because we're so busy in the process of doing and trying to make things happen. So we know that 90% of it is planning. And I started off planning poorly. In my first 3 years of practice, I generated nice profits, but I was so busy into the practice, I didn't have that bookkeeper. I didn't set up my financials the way that I should have to know where I was. I was too busy in it. And I hired a CPA who literally held my books hostage, was not doing what I was paying them for, but I was so busy trying to build that I didn't see it. So the first thing I would say is align yourself with the team, get your attorney, get your CPA, and get your bookkeeper, because if you don't know your numbers and know where you're at, you can never grow. Also, trust yourself. Now, I'm a risk taker, so that can be both a benefit and a hindrance for me. Because what that means is I am one of those individuals that's more concerned and more unhappy with not taking advantage of an opportunity. So I may jump to, making a risky decision that, later on I may regret. But for me, it's more of not taking this opportunity and it panning out versus taking the opportunity and it not being beneficial for me. So if someone is looking at, okay, am I ready to make this transition? My number one is, you're going to work hard for somebody else. You might as well work hard for yourself, but also have a realistic expectation that you're going to work harder for yourself than you are someone else, because starting off, you're more than likely going to be doing everything. Plan well. Try to secure funding if you need that before you leave a job or start another career. And whether that funding is, family capital, but make sure you have some things in place where you can afford to take that risk and try it. Worst case, you may not succeed the first time, but one thing that really helped me through the process was back in 2008 when I opened my first practice here in Austin. The housing market and the financial crisis was happening. No one was lending money. But what kept me encouraged instead of discouraged was the fact that I read Magic Johnson's book. He had a book on business, and he talked about all these places he went to, all these banks. He was asking for money. And I'm thinking,
Doesn't he have the Starbucks
he's
story?
got
Yeah.
everything. Magic Johnson owns
Movie
the
theaters.
Dodgers. He's got Starbucks. He owns part of Airmark. But when he was starting his business, he couldn't get a loan. I'm like, but that was Magic Johnson with millions of dollars. And to hear how many times he was told no, but he kept going despite that. And now look at what he's built and how he's helping other business owners and entrepreneurs in the process. But I said, okay, if they're denying him, then okay, let me brush my shoulder off and keep on going. So I started my first business with, a microloan, a $19,000 microloan. I bought two pieces of equipment with it. I maxed out my credit cards, and I took a chance on myself. So you have to have tough skin. But I believe that trying and failing is better than not trying at all. And so you have to have, that mindset, but 90% of it is preparing. I was not well prepared for it. Get some mentors. I think chiropractors are better. I know they're better business men and women than medical doctors are, because I've worked with several, and they usually don't get much, if any, business training. We get a little bit more, but seek out the information you don't know, especially if you're not a legacy practitioner. Ask mentors, find people that are smarter than you that have been in business, and investigate. There's a lot of practice management groups, and that's another issue that I think I've spent probably hundreds of thousands of dollars on, where I probably could have learned that same information a lot less expensive. But having a mentor is going to be number one. So I would say think, but don't be scared to take a chance and trust yourself and see what happens.
So is that what you do? Like you do like mentor, if you will? Like
I do, yes. I try and mentor other, practitioners. I do consulting for practitioners that want to integrate their practice. So if it's a medical doctor that wants to bring in, a chiropractor, or vice versa.
which you said you've always kind of done with
I've always practiced that way in an integrated practice. Right now, I also wear another hat where I'm working with a large group that is here in town. So I think I like to be busy. But one of the biggest things that is the most rewarding to me is seeing a young doc come out, open up their practice, or call me and just ask me for advice. A lot of times they don't even know the simple step of, how do I set up an LLC? Do not, whatever you do not start off with a sole proprietorship because you leave yourself at risk. And greatest tip is have malpractice insurance. Like, that's important. Have that, make sure you cover, what you may or may not need. And that's where risk management policies, come into play. Hopefully you'll never need it, but you rather have it and not need it than need it and not have it.
Before we wrap up, my last question to you is one that we throw and pose to everyone that I sit with. Is what is something, and also, I'm asking this from the perspective of mentoring anyone that's listening. What is something that you have fundamentally changed your mind on over the years, personally, professionally, from just your life experience?
I think the biggest impact currently that has changed my mind over the years was cannabis in itself. Because initially, when I'd hear about medical cannabis, and I was like, haha, they're just trying to get high. It wasn't until my father's experience led me to finding out that there's actually science behind this plant. There's actually, a system that's helping the body. And so I was ignorant about it until I had that personal experience. So that's been the greatest aha moment. And to be a part of, the Society of Cannabis Clinicians, to, see the evolution of, product development and, the research that's coming out in this industry. And we're just scratching the surface. I think that's the biggest aha moment or change that I have personally, because
But
I
you,
want to be a
you
part of it.
definitely, sorry to interject, but you still, even though it took you a while, you weren't late to the game, right? And even anyone who, turns, maybe listens to this or takes the online course and changes their mind around, or is more open-minded towards medical cannabis, they're also early on in the game, right? Only in decades from now, or I don't know, centuries from now, will we be in the game of
Right.
cannabis.
That's so true. But I never thought I would
Be an advocate for medical
be an
cannabis.
advocate for medical cannabis, recreational, any cannabis at all. I never saw myself in this position, and to be able to see how it's helping people and to really witness the use of cannabis help someone get off of opioids and increase their quality of life. Um, I just think that, now we're scratching the surface. So I want to say that's probably one of the biggest impacts that I am surprised about, because I did not see, almost 10 years later, me being on this end from that experience.
Well, it's been a pleasure spending time with you. So thank you very, very much. And I sincerely hope that we can do this again sometimes. Recording here from Austin, Texas. I will enjoy another meal of barbecue this weekend, and then head back to Florida. And I hope we can do this again. So it was really, really great. So I appreciate it very much. The time here, the time in the studio, and hopefully, we put together a good, CEU course for body workers to learn about all these different components, and someone who is open-minded already can maybe take it to the next level for them, and someone that isn't open-minded, maybe they can help them open a slight door into it, or a window into this world. So Dr. Kirsten K. Shepard, thank you very, very, very much.
Thank you, Danny P. I appreciate you having me, and it's been an honor and a privilege. And come back to Austin anytime.
Will do. Thank you very much.